Gender dysphoria is a complex condition characterized by a profound discomfort or distress caused by a discrepancy between a person's gender identity and their sex assigned at birth. This article delves into the detailed process of diagnosing gender dysphoria, offering insights into the steps medical professionals take to identify and support individuals experiencing this condition. Understanding gender dysphoria. Before diving into the diagnosis process, it's important to understand what gender dysphoria is. It involves a conflict between a person's physical or assigned gender and the gender with which they identify. This conflict can result in significant emotional distress, affecting overall well-being. Initial consultation. The diagnosis process typically begins with an initial consultation. Here, healthcare providers gather comprehensive personal history to understand the individual's experiences related to their gender identity. This stage may involve discussing the person's emotional, psychological, and physical well-being. Mental health assessment. A crucial step in diagnosing gender dysphoria involves a thorough mental health evaluation conducted by a psychologist or psychiatrist. This assessment helps distinguish gender dysphoria from other mental health conditions that might cause similar symptoms. The professional evaluates the distress or impairment caused by the gender identity conflict. Criteria for diagnosis. Diagnosis of gender dysphoria in adults and adolescents typically follows specific criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. These criteria include a marked incongruence between one's experienced or expressed gender and assigned gender, lasting at least 6 months, with at least 2 of the following: a strong desire to be rid of one's primary and/or secondary sex characteristics due to a marked incongruence with one's experienced gender. A strong desire for the primary and/or secondary sex characteristics of the other gender. A strong desire to be of the other gender. A strong desire to be treated as the other gender. A strong conviction that one has the typical feelings and reactions of the other gender. Physical examination. Although not always required, a physical exam may be conducted to rule out any medical conditions that might influence gender identity or contribute to symptoms similar to those of gender dysphoria. Ongoing support and evaluation. Following a diagnosis, ongoing support is crucial. This can include counseling, participation in support groups, and in some cases, hormone therapy or surgical interventions. Continuous evaluation helps in managing the condition and supporting the individual's transition goals, ensuring their mental and physical health is monitored throughout their journey. Conclusion. The diagnosis of gender dysphoria is a careful and considered process that not only involves multiple criteria but also requires a compassionate approach from healthcare providers. Understanding this process can help demystify what individuals experiencing gender dysphoria go through and highlight the importance of professional support in their journey of self-actualization.